Let's talk about bladder leakage, also known as urinary incontinence. Although many people don't want to admit it, urinary incontinence happens to many women. About 1 in 10 women in their 20s experience this problem, and this number grows as we age, affecting about 1 in 3 women older than 50. And that only includes women admitting having this problem. Even though more women experience urinary leakage as they age, it is not a normal part of aging. It is important to know that you should not be ashamed if this is happening to you. Luckily, there are treatments for bladder leakage. This may include physical therapy, medications, removable vaginal devices called pessaries, or even surgery. However, the choice of treatment will depend on what type of bladder leakage you have. There are 2 main types of bladder leakage, and they are treated differently as they have different causes. The first type is called stress urinary incontinence. Think about this problem like a structural issue. Imagine that this is your bladder, and the tube here is the urethra, which is what carries your urine to the outside world. When you cough, or sneeze, or laugh, or do activities like exercise, there is pressure on the bladder and the urethra, like this. However, the tissue in the pelvic floor is supposed to support the bladder and urethra and prevent urinary leakage. Sometimes, though, this area becomes weak. And when that happens and you cough, exercise, or laugh, the support isn't strong enough to prevent the leakage. Why does this tissue weaken? Well, this can be related to age, pregnancy, childbirth, medical conditions like obesity and family history. If your relatives have had this problem, you might someday have it too. The second type of bladder leakage is called urgency urinary incontinence. Sometimes this is referred to as overactive bladder. The term overactive bladder does a good job of describing what's going on. Remember how stress leakage is a structural problem of the area under the bladder and urethra? Overactive bladder is an issue with the bladder itself. The bladder is squeezing at inappropriate times. Do you get the sensation that you need to empty your bladder and can't make it to the restroom in time? Do you leak urine as soon as your hand touches the doorknob when you get home? These all may be signs that you have this bladder problem. Some people have frequent, strong feelings of needing to empty their bladder. And if this becomes bothersome, even if you don't leak, you may also have overactive bladder. To discover what type of bladder leakage you have, your doctor could ask you to track when and how much you leak, or they may ask you to undergo a bladder test in the office. This kind of testing is important because the different types of urinary leakage are different, and so are their treatments. The most important thing to remember is that urinary leakage is something that can be treated. Don't be embarrassed. Talk to your doctor to find out what can be done for you.